Hi, everybody. Dr. Stephanie here. Women seeking wellness, family seeking wellness. We're doing a kind of a blend of both nowadays. And so everything that gets on one podcast gets on the other. And I'm so excited that we have Dr. Martin Rosen on the show today. And I just think I met him in ICPA, which is that, again, I've talked about it before, the International Pediatric Chiropractic Association. And it's a group of very like-minded, very driven, passionate chiropractors that really want to help kids and want to help humanity. And, we all know that in order to do that, you got to take care of the moms and the babies and all of everything in between. So instead of me introducing him, I would love for him to introduce him. He knows why he's great, and we'll go from there.
All right. Well, thank you, Stephanie, for having me. I really appreciate it. And I'm looking forward to this conversation. Short version of who I am: graduated chiropractic school in December of 1981 with my wife, Dr. Nancy Watson. When we graduated, we were 7.5 months pregnant. We packed up all our stuff, moved from Georgia to Massachusetts, where we knew no one. And we're 2 months out of, actually a month and a half of having a baby. I had a new job in a chiropractic's office. I was working for this chiropractor. Nancy had the baby, and we had this beautiful, wonderful child. And we had just graduated chiropractic school. We had all these hopes, dreams, and aspirations. And then we had a baby, and life changed. So how I got into pediatrics was simply that we were both, very dedicated to the chiropractic profession. We had taught actually our first seminar in 1979 together. And so we had this baby that we knew needed care. We knew about the functional potential of human beings. We wanted to help her, like everybody, every mother, every father wants the best for their child. So we had to learn pediatrics kind of on the fly. I was lucky at the time to meet a man named Major DeJarnette, who actually graduated chiropractic school in 1924. But he had an amazing, vast array of techniques, and he understood the importance of pediatric care in childhood. So he was my mentor, and we just moved from there. And I started developing a pediatric program, pediatric practice. My wife actually stayed home for several years. We had a second baby, and then she went to practice on her own. And we kind of both had our own practices for almost 20 something years. And then she came to work with me in our practice, and our daughter, our youngest, is a chiropractor as well. She graduated in 2013 from Life. And my older daughter used to run a healthcare school, basically in Colorado. And she is out there, and she lives in Boulder, Colorado, actually Longmont, Colorado. And so I have been teaching for 40 plus years. I'm a certified craniopath. I've written several books. And I'm certified from three different organizations, certification. I've lectured and taught pretty much all over the world. And it's my passion, besides running the practice, adjusting people, especially babies. My passion is teaching. So that's who I am.
I mean, I love that, because the same, in a way, that's a lot of similarity in my own story, other than the fact that I don't have kids, is that I came in the back way as far as pediatrics, where I think when you graduate, I think nowadays there are some kids that maybe really get where they want to be. Yeah. And I wasn't that. I was just like, I hope I can stay afloat. You know what I mean? My practice.
No, I get it. I get it.
And then my friends started having kids, and then they, their kids and my nephews and nieces. And then all of a sudden they're putting their kids on Ritalin and, having all these kind of issues. And so for me, I kind of backed my way into, well, shit, I got to know more than they do. Exactly. And so I started to cobble together this knowledge of chiropractic and pediatrics to where, like you, it's my forte. It's what I do. It's why the majority of my patients are either pregnant or babies. So, it is that thing. But for you, when you get asked a question like kids, chiropractic, like, how do you answer that not to another chiropractor, just to a lay person? So
a couple of things. In my office, first thing you do when you walk through the door, there's this wall, and it says our chiropractic kids. And there's over 200 pictures that we change. And then when you go to the front desk, over the front desk is a video screen that flashes all these kids with little PowerPoint presentations about it. So what I explain to people is simply this, that whether it's a good birth, a bad birth, a difficult birth, an easy birth, that when your child is born, you bring them to the pediatrician to check certain parameters. Well, one of the things the pediatricians, if not within their bailiwick or their ballpark, is really checking out the mobility of the spine, the cranium, the motion, and how that affects the nervous system. So that's what our expertise is. That's what pediatric chiropractic is about, is checking function, structure, and how it affects the nervous system. So therefore, and I tell people that, look, the first 2 years of life, you're laying down the foundation for the central nervous system for your child that they're going to carry with them for the rest of their lives. And that the healthier that nervous system is, the better they will be functioning for the rest of their lives, the better they'll be able to adapt to stress, the higher their threshold. So my job is to evaluate your child to make sure that when they come onto this planet, that their nervous system, spine, and cranium is functioning as best it possibly can, so that we can lay down the most healthy foundation for them, regardless if they have symptoms or not. The idea is actually to try and prevent them from having symptoms, right? We want them to stay as healthy as possible. Parents don't want your children to have this, but if they do have symptoms, we also have an approach where we can access the nervous system and basically help the body be able to heal from all types of things, from whether it be chronic ear infections, colic, reflux, torticollis, flagellosis. I mean, the list is kind of endless. Yeah. So what we're dealing with is making sure that there is normal function, so that normal function and normal structure are integrated. And the whole idea in the pediatrics, is, again, as I say, is laying that foundation that they're going to be living with for the rest of their life.
Yeah. I mean, I always say I have a continuum kind of between illness and wellness on my in my wall. And I say, you know, I don't want your babies to be well. I want them to be like on the nth degree of well, like they have new car smell. Like there's, you know, and if they're not at that, you know, well, we want them all the way as far as possible, as far as potential. And then as a parent, you know, your job is to try to help them not get screwed up, you know, with the stresses of life, from physical to chemical to emotional to, you know, spiritual, all those kind of things. But I loved, you know, that you had just talked about, and I'd love to hear your take on it in a way that my people, the new people to this idea, would understand. Your head, I thought you weren't supposed to touch a baby's head because they have soft spots.
Great. So I just happen to have a head here.
Oh,
look at that. See? How's that? So
BYOH.
This is an infant's cranium, okay? And these are the soft spots that you were just mentioning. There's one in the front, there's one in the back, and there's 4 on the sides, 2 in the front side and 2 in the back side. And so the reason these are so important is because for the first year of life, the infant's brain is going to grow 101%. So the whole idea of this cranium is to allow the brain to expand, right? That is its whole job. And then the second year, it's going to grow another 15%. And by the end of the second year of life, 80 to 90% of the central nervous system in the brain is going to actually be laid down. So you're talking about 80 to 90% of that system. So this cranium is designed to do that. Now, if you go online, or if you just listen, the American Pediatric Association has actually said that 47% of children are now born with some kind of head deformity. So what makes that a problem is, if you think about this, there's a tissue underneath this called the dura. So it's like a tent that lays over the brain. And if you think of a tent that, you know, when you put up a tent, you want to put it up symmetrically. If you pull on one side of the tent, one side will get tight, the other side will collapse. What happens inside the cranium is the same thing. If there is distortion in the cranial bones or in the spine, because this tissue attaches all the way down to the tailbone, it can pull on that tent unequally. And that tent is made up of stuff called the duromeningeal system. And what that tent does is two main things. It controls the tension in the central nervous system, so how the nerves fire, and it also controls the movement of cerebral spinal fluid. And cerebral spinal fluid is basically the lifeblood of the central nervous system. Like your body has blood supply, and your body has a lymphatic system. Well, the central nervous system, lymphatic system, is the cerebral spinal fluid. So that flows through this duromeningeal system. So if it's too tight or too loose, it can disrupt that flow. Also, if it's, too tight or too loose, it can change the way the nerves vibrate. If you think of a nerve like a string in guitar, it has a certain tone. That's how it works. If you tighten the tuning key too much or too little, you change the tone of that nerve. Well, the same thing happens inside this system. If the dural meningeal system is too tight because the cranium or the spine is distorted, it's going to change the way that nerve basically vibrates, which is basically the way nerves transmit impulses.
How do you notice the distortions happen? Like for me, one of the main things I see, as a chiropractor that isn't an expert in the cranium, I send it to people that are. When I see this, is that I find there's a lot of head preferences and turning, and then they don't catch it early enough, and then they get flattening in the back of their head. Exactly. And sometimes the first and only thing people think about with the head is my kid going to have to wear a helmet? They don't they connect it as an aesthetic thing rather than when I say, remember, there's a brain in there, right?
Exactly. So it's the same thing if you look at a spine, right? If you look at somebody walking down the street and you see one shoulder high and one hip high and their spine looks distorted, the first thing you may think of, especially if you're sensitive to that, your visceral feeling like, oh, they must be in pain. That must be uncomfortable, right? Well, think about a kid whose head, like you look at your child and let's say one eye looks smaller than the other, or when they open their mouth, their jaw will deviate to one side. Or if you're a nursing mom and you find out, let's say the child can nurse better on one breast compared to the other, like why is that? The thing you mentioned the best is turning. If they can't turn their head to one way, or they tend to preference turn their head to one direction all the time, those are all signs of what we call compensations. If you think about this, if you hurt your right knee, are you going to lean on it or are you going to lean away from it? So kids intuitively will try and compensate for those distortions. And again, things like jaw movement, nursing inability, or nursing on one side better, not being able to turn, or hitting milestones, right? If you have a child that's 4 months, 5 months old and can't lift their head up, that's a problem. So you're looking for all these, if a child can only turn over in one direction, right? They can't turn over. Or if your child, every time you put your child in a car seat, they scream bloody murder, but they're happy in a swing or they're okay in a stroller. So those are all indicators that they're compensating and somehow you've hit their threshold. And as a baby, when you hit a baby's threshold, they cry. That's how they let you know, right? Whether they're hungry. Right. Whether they're hungry or their diapers bothering them or they're, uncomfortable or they're scared, that's how they relate, especially in that first year of life.
It's amazing how many moms will blame their milk production.
Yeah. It's
and it's so, for me, it's an obvious thing as I'm seeing it now. Again, these distortions happen in your experience. How are the biggest ways that you see the distortions happening?
So the two ways they can occur in utero if the baby is lying in an abnormal position. And they also, one of the biggest ways is during the birth process. Okay. There's a certain amount during the transition period as the child goes down the birth canal. The whole idea of this little cranium again is for it to compress. The sutures compress so that the baby can come down the birth canal. And when it compresses within the first 7 to 10 days, it's supposed to rebound. Okay, it's supposed to go back into a normal position. And what happens is sometimes during the birth process, especially if there's an assisted birth, whether it be forceps delivery, vacuum delivery, or abnormal presentation, or just a very, very long labor, that process basically doesn't re-expand all the way because of the trauma that happens. I mean, the good news is that 90% of the things that happen to us traumatically, whether it be physically, mentally, emotionally, spiritually, our body adapts to without any consequences. But there's that 10% that we either adapt to but create compensatory changes. So if it's a difficult birth, a long labor, even too fast a labor, even a baby that shoots out. So any of those things can cause stretching or damage to this tissue. Again, most of the things that happen in children's spines as to their nerves are not like compression, like people always think of pinched nerves for chiropractors, but in infants, that's not the case. It's stretch nerves. They get too tight. They get traction. So any of those things can cause that issue to occur. Then we have a whole plethora of, tongue tie, very common, right? Tongue tie is a compensation. Well, it's the tongue tie, but also the position of the tongue affects how the cranium is going to form and grow normally because the pressure of the tongue against the palate makes a difference. So if your kid has tongue tie, lip tie, buccal ties, that's going to affect the craniofacial mechanics. That's even when you get them revised, if they've been there for a period of time, then that compensation needs to be dealt with as well as having the revision.
It's amazing. Like you're mentioning all these things. And I always tell parents, this is like a cascade of things. And I'm just checking them off. And it's amazing the amount of parents that come to me that is like, yes, long labor. Yes.
Yeah,
you know,
exactly.
sometimes long labor, then it's a precipitous birth. That baby shoots out like a torpedo.
Exactly.
And then, you know, and then they have some ties, or then they have, you know,
It's
trouble breastfeeding. And then they have, and so it goes on. And then that could show up as colic, and that could show up as not latching and all.
And then then they get an eczema because they get toxic, or they get or they get asthma stuff. Or one of the most common things I see is constipation. Kids who are not digesting processed food. And the problem is parents often know that there's an issue, but very often the worst case scenarios, I once had a parent come to me that she had been to a pediatrician. The child had not had a bowel movement. This is a true story, 21 days.
Right.
And the pediatrician wasn't very concerned. So, you know, and I've had it anywhere from, you know, 7 days, 14 days, you know what, and the bottom line is, and for moms, because I know a lot of moms are on this, if you feel like there's something wrong, you're probably right.
Right.
Your intuition is, and, you know, if you're going to a pediatrician and they're not addressing that issue or just blowing you off, then you need to find somebody who will be receptive. And the good thing about pediatric chiropractors is because we look at the child as a global entity, we don't piecemeal them, that if mom says, you know, she's just not behaving right, or just not right, we'll be able to evaluate the function of the nervous system and maybe not pinpoint the disease, because that's not a thing, but we can pinpoint the dysfunction.
Right.
I'll tell you, I'd like to tell you a story around that.
Okay, great.
We had a woman come to us. She was visiting her mom in our town, and we live in Wellesley, Massachusetts. Our office is there, and she was from California visiting her mom. She had an 11-year-old daughter, and her mom had known about us. And she said, "Why don't you bring your daughter, Dr. Rose, for evaluation while you're here? You're going to be spending the summer, you know, you maybe check her out." So we did an exam, came back in. On the second visit, we give parents a report of findings. We told them what we found in her child, and the mom just started crying. And she started crying. And, you know, we stopped. I said, "You know, what's up?" She goes, "I've been telling people for 10 years that there's something off about my daughter. I have 2 other kids. I know there's something off about her. Now it's at 11, she's having trouble in school. She's having some behavior issues. You know, she's just not adapting." And I said, "And now I finally found someone who at least can acknowledge what I found." And, you know, thank God, but she'd been literally 10 years from one pediatrician to another saying, "You know, it's fine. She's okay. You know, she's just a little different." I'm not saying that kids aren't, but again, this mom intuitively knew, and it was just such a release for her to find somebody who would at least acknowledge it, and then we could help her work with it. So yeah, that's the kind of stuff that you see.
Right. I mean, it's for us, you know, what I just keep hearing from you that we haven't mentioned yet is the vagus nerve and that whole connection. Right. Exactly. And I'm amazed at how many people have actually heard of it when I mention it. But that, you know, when I mention to people, you know, again, how the connection of the head and the upper neck can relate to how pooping happens, it just is a disconnect. And I think just that understanding about how the nervous system controls all of the functions of our body.
Well, the vagus nerve would be great. So there is a lot of stuff probably in the last 5 years that come out about the vagus nerve. And there's, you know, a lot of theories, a lot of talk about the function. But the vagus nerve really has 3 functions. It functions as what's called the autonomic nervous system, which controls all your vital functions, including digestive. So it has what they call a parasympathetic and sympathetic input, which is basically both sides of that. It also has an emotional input. So it's a cranial nerve. So the cranial nerves, most of the cranial nerves just are in the cranium. Matter of fact, there's 12 of them, 9 are in the cranium, but there are 3 that exit right at the base of the skull here and come down along the cervical spine. And the vagus is the longest of the cranial nerve. So it comes out from behind the skull, comes over this first vertebrae here called the atlas, comes into the clavicle, goes down through the diaphragm, your breathing mechanism, into the small intestine on one side, the large intestine on the other side. And it contributes to all different functions. It contributes to digestive issues. It contributes to heart rate issues. It contributes to swallowing issues. It has the largest impact of any cranial nerve in the body. So if that nerve gets irritated anywhere along the pathway, it changes the way that nerve can function. And once it changes that nerve function, then it can affect basically the balance of the autonomic nervous system, rest and digest and fight or flight states. It can also affect your mental attitude because it does stimulate part of the midbrain, which is where the fight or flight response is. So for example, if you have a baby that's very irritable, can't sleep well, has colic issues, just very, very tense, very, very tight. Well, imagine if you had a nerve that was attached here and went all the way down to your large intestine that was too excited, you ever have a toothache, right? A tiny little nerve the size of a hair, how much pain that can cause. Well, imagine this nerve that goes all the way down. That's 50 to 100 times bigger than that, getting irritated. Now you have a baby who's tense all the time because it's like someone's poking their system all the time and they can't express it.
Right.
So
I always say to parents, I go, okay, now imagine you're standing on your head. And I go, okay, now turn your head to the whatever side the child's head's turned to. Right. And then usually, and a lot of times they're also extended a bit. So I'm like, right. Even just doing that. So that already, I can feel it in my neck. Now, exactly. Imagine catapulting down the birth canal. Like it's a dicey business.
Oh yeah, definitely.
To begin with in the most perfect circumstances. So Absolutely. You can see how that nerve can be affected and how it can affect everything all the way down.
Well, think about this. If you have a child who hates tummy time, for example, or a child who can't, right? So often when children are uncomfortable, they'll arch backwards, right? That's more often than not. They don't usually pull forward, they arch backwards. Well, I'm just going to bring my little baby here. There's a little doll, right? So if I have a dural system that attaches all the way to the tailbone and then all the way into the head, and actually in infants, that dural system comes up through these sutures of the skull and becomes part of the cranium, right? So if I have a string there that's too tight and it's irritating me too tight, what am I going to do? I'm going to try and bring my head closer to my tailbone to loosen the tension on that string. But anytime you make me do this, either if it's sitting or any position where you make me stretch that, I'm going to be more uncomfortable. So if you're nursing, right, and I'm in this position and I pull that string, I may have a hard time nursing because it's uncomfortable, not only the pulling, but also that vagus nerve we just talked about influences my swallowing ability. Mm-hmm. So that's why some kids, you have to adapt different positions, like, the football position, anyway, to keep their spine out of those areas of tension. But if we correct those imbalances that cause that tension and we retune the nervous system, relax it, then all those symptoms start to dissipate because now the baby is not in a hyperexcited state.
Right. And I always mention to parents, because I don't think they don't understand this, that latching is a reflex. So if I hit your knee and I hit your knee, your leg pops up. That's a reflex. Right. So if it doesn't, that gives us an idea something's affecting that nerve. And so latching and breastfeeding is the same thing. Like if we had to teach infants how to breastfeed, we would not survive as a species. It is programmed in us. So if something isn't happening correctly, then something is being interfered with in the nervous system.
Absolutely.
Because I've even had them where they say, the lactation consultants say, you need to work on the muscles. The muscles are weak. And it's like muscles, there's no push-ups for this. Like this is about the muscles are weak because the nervous system.
Not getting proper nerve supply.
Right. Exactly. So how do you recommend just, as our time is kind of coming to the end, we could talk about this all the time for hours and hours. How would you recommend, here we are, people are listening from here, near and far. Right. How would you recommend they find help for this in their own communities?
Sure. So pediatric chiropractors are definitely a specialty, just like pediatricians are, as opposed to orthopedics. So there's several venues. Number one, if you want to go on our website, it's called drmartinrosen.com, and go to a section called Our Graduates, and it'll have a drop-down menu. And we have people from all over the world that are certified and taking our classes. We have a certification program. The other place is the ICPA that you mentioned, and their website is at icpaforkids.com. And they, again, go on their website. They have a whole list of chiropractors all over the world as well. There's another group called the ICA, also, which runs PD. Matter of fact, I'm going to be speaking at their symposium in November this year. So they have a group of chiropractors. So what you want to look for is somebody who specializes in pediatrics. Just like if you had a 2-month-old that had a particular health issue, you wouldn't want to go to a regular internist. You want to go to a pediatrician. So it's the same thing. So those are 3 venues that I know of for sure that I can, at least that I will rely on, and I will. It's the drmartinrosen.com, our website for certification, the ICPA4kids.com, and I'm not sure the ICA link is, but it's the ICA has a whole pediatric program that I've heard and really good things about. Yeah. So that's one big venue. And if you have a chiropractor of your own that you're going to, ask them if they do pediatrics, number one, or if they don't, just like you said, if you have cranial issues with your patients, you'll refer to someone who does those cranial work. That's, that's so those are the easier venues to find.
How would you recommend a chiropractor that's listening to this get more training? Like, tell us about your program. Tell us about what you offer the chiropractors.
So we have, we developed in the last 2 years, a new teaching institute. It's called the Peak Potential Institute. And the website to go on is peakpotentialprogram.com. And that peakpotentialprogram.com has a listing of all our classes, both online and hands-on, gives you the availability to do our certification program. It also has our books. We have 2 books, and I'll mention the other one in a minute. I have a pediatric chiropractic care book, which is for chiropractors, and it does spinal and cranial adjusting and evaluation. And then this book, which I'm going to hold up here, it's called, my wife and I wrote this, it's called It's All in the Head. And this book we wrote during COVID, and it's for lay people as well as chiropractors to describe everything we just talked about. It talks about milestones, reflexes, and it also talks about the difference between what's common and what's normal, basically what you want for your child's potential. And it's written for lay people to understand the intricacies of what we talked about, the anatomy and physiology and some of the neurology. It's also written for chiropractors to give to their patients so that they don't have to spend all this time explaining it. They can explain something and say, here, read this book. A lot of chiropractors, we know, keep it in their waiting rooms or in the adjusting rooms so people can read them. And so it facilitates the communication between what we were talking about. And that book can be purchased either on its own website called it'sallintheheadbook.com. It's also on Amazon. I'd rather you purchase this not from Amazon. I think Bezos is doing fine without us. But it's allintheheadbook.com, or you can get it on the Peak Potential Program website.
Awesome.
So, and last piece, just one thing. If you want to contact us in any way, whether you're a patient, or, a lay person or a doctor, just email us at drmartinrosen@gmail.com.
That's awesome. Well, thank you so much for this work that you're doing and continuing to do and evolving and leaning into helping people. I think in this day and age, so many people feel powerless about their health and now they're waking back up to the idea that we actually have some control. And so I appreciate you being out there doing it.
Same back to you. I appreciate you doing this work. I know people think, oh, it's a podcast, no big deal. I know what it takes to get back end of this and committed to it. This is Sunday. This is our Sunday afternoon, So Again, what you're doing is awesome. Thank you for having me. And I hope you just keep going, because we've watched a number of your podcasts and they're awesome.
Wonderful. Well, all the information that he just gave will be in the show notes, so you don't have to stop your car and drive. It'll all be in there. And thank you so much, Doc.
Thank you. It's great talking to you. Thanks a lot.
You too.